Assalamu alaikum. Now, one history on cardiovascular system. This is the chest pain. So, first of all, before entering the room, 3 minutes. In 3 minutes, what should be the differential diagnosis of a chest pain of 11 years or 15 years old girl? So, the cause may be the cardiac cause in the under the heading of the cardiac cause: pericarditis, pericardial effusion, coronary artery thrombosis, bacterial endocarditis, myocardial ischemia following is severe aortic stenosis, pulmonary stenosis, coronary artery disease, post Kawasaki cardiomyopathy, chest proliferation, pulmonary embolism, pneumonia, um, pneumothorax, acute chest syndrome, and musculoskeletal costochondritis, trauma, deformity, GIT, gastroesophageal reflux disease, psychological cause, maybe following the drugs. And so history, for history is just like other station, rapport formation, and then introduction, and then taking permission for note, that is the RIN. And then would you give an open ended question that what is your main concern, will you please describe the pain for me? And that description we are looking for what is the site of the pain, what is the characteristics of the pain. First of all, that onset, course and duration. When you notice it, does it progress over that time, how frequently this chest pain occur, and then let me know about the site of the chest pain. Does this pain goes anywhere? Can you describe the pain for me? And then do you notice any factor that increase the pain, how the pain is relieved? And this pain is associated, do you notice that there is something in your body that feel associated with this pain? Do you feel any kind of pallor, palpitation during this time? And then asks about the constitutional symptoms. Is there any fever? Do you have any concern regarding your weight? And what's about your sleep? And then activity. And now I'm going to ask you the symptoms of different parts of your body to make sure these are present with you or not. So do you have any kinds of feet, any weakness, any part of the body, any headache? And for cardiovascular system, is there any palpitation, blue color skin? And then GIT, any do you feel nauseated, any throw up, any tummy pain? What's about the tummy size? And do you have any concern regarding your pee, in your poo? And do you have noticed any pallor? And then important history is that do you have any long extending illness along with this? Here is very important to ask about, we have to focus on asthma, gastroesophageal reflux disease, sickle cell disease, Kawasaki, congenital heart disease, and cardiac intervention, any history of trauma present or not. And you take and if it is 15 years or more than 13 years, so we have to take the head cyst is there, we will take the history of recreational drugs, oral contraceptive pill. But here we just want, do you have take any regular medication or not? And then after this perinatal, there will be perinatal history, and then developmental history, growth history, and then vaccination, and any hypersensitivity to any medication. And after that, family history is very important here. Any sudden cardiac death, any congenital any cardiac disease running in the family. And here this emphasis on long QT, Brugada, cardiomyopathy, connective tissue disorder. And then we will ask the history of hairs as adolescent. And how you, what's the differential diagnosis? It comes along the presentation. And now the three colors: green zone, yellow zone, and the red zone. In the green zone, if in the history we found that it's a chronic pain, it's a superficial pain which can be reproducible, there is associated with cough, wheeze, and it is worsened by any movement, eating, posture, and then anxiety or triggering factor is present. So it is the green zone, and this green zone, the causes may be musculoskeletal, respiratory, GIT, psychological. And here the management will be, in all this chest pain we will go for the detailed history, and for examination, general examination, vitals, SpO2, and then full cardiovascular system examination. And we will investigation, we will do the 12 lead ECG, where we are looking for any rate, rhythm, ischemia, ventricular hypertrophy, corrected QT. And can do the chest x-ray if there is severe chest pain and patient has fever with cough, and on examination respiratory system has the findings, so we can do the chest x-ray here. And management of the green zone, reassurance, NSAID and follow-up. And then amber zone. Here in the amber zone we can find the in the history, pain is associated with exercise, pain is radiated to the jaw or arm, pain is associated with palpitation, syncope, known congenital or acquired heart disease or previous heart surgery, and family history of sudden death, cardiomyopathy, long QT syndrome, Brugada syndrome. Here the management, the cause may be myocardial ischemia, pericarditis, pathological arrhythmia such as SVT, left heart obstruction. And management will be discussion with pediatrician, expert in cardiology, and refer to pediatric cardiology OPD. And in the red zone, recent in the recent history of cardiac surgery less than 2 weeks, no connective tissue disorder, known case of connective tissue disorder such as Marfan syndrome, known Kawasaki disease with coronary artery involvement, hypercoagulation state, obesity, oral contraceptive pills in females. And the cause behind this may be pericarditis, post pericarditis syndrome, pericardial effusion, pleural effusion, bacterial endocarditis, aortic dissection, coronary thrombosis, pulmonary embolism. Here prompt decision have to take either from pediatrician, expert in cardiology, or on-call pediatric cardiologist. Thank you. Assalamu alaikum.